Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Jasper says, my daughter at only 9 is suffering from anxiety, which feeds into her depression. Any ideas to help? She has mentioned that she wants to see God. A little scary to hear. We are getting an emotional support puppy to help her regulation.
Yeah. I would really quickly get together with a psychiatrist. I would definitely do that. And try to get her on some medications. And I don't usually insist on anything for parents, because some parents are like, I don't want my 9-year-old on medication, but I'm kind of insisting on this one because what's harder to deal with is severe depression. And I don't want her to get into severe depression. So the medications, in my opinion, are not harmful. And I'm talking about serotonin's reuptake inhibitors, SSRIs, which stands for selective serotonin reuptake inhibitor, or SNRIs, which are serotonin and norepinephrine reuptake inhibitors. And these are meds like Prozac, Luvox. I mean, there's just so many, Cymbalta, etc. There's like 10, 15 now. And they will start with low dose because it's a younger child. So please don't worry, because all that it does is it allows your child's neurotransmitters to stay available in the nerves, in the nerve synapses longer, so that your child can absorb them more. So it's not like it's not producing it's not bringing a new foreign substance to your body. It's just making your body, absorb these neurotransmitters a little bit better. And these are the neurotransmitters that are responsible for anxiety and depression. And so when you do absorb them better, you just become, and it doesn't change your personality at all. Like, this is one of the questions parents ask me. But it does not. You don't even notice it. It just makes the individual a little less reactive to sadness and worry. And those are very important. Now, the treatment, and this depends also on your child's, what's causing the anxiety and depression, and also like the level of understanding. But the primary treatment is cognitive behavior therapy. And the cognitive behavior therapy works the best, and there's a lot of published research on this. Therapy, so seeing a psychologist, works best when it is combined with one of these medications that I just talked about. So I would do both. Yes, an emotional support puppy would be great too. It will produce a sense of comfort for her. But really, you got to figure out, Jasper, like, what is causing the anxiety? By the way, anxiety and depression are the same thing. People don't realize that. It is anxiety and depression are so much the same thing that they're actually the same medication. Exactly the same medication deals with anxiety and depression. Depression is kind of anxiety that has not been dealt with. And anxiety often with our kids has to do with not fitting in, feeling a little different, not quite understanding everything that's going on around you. If you think, and then also the sensory sensitivities, if you just think about that, like I have, as you know, I'm very passionate about this whole aspect of anxiety in our kids, Shannon. I've given multiple talks about this because I swear to you, if I list just the symptoms of autism, and if you yourselves as adults think about these symptoms and you think like, okay, I have sensory issues with light and sound, they bother me. I'm not sleeping very well. 90% of our kids have sleep issues. I have some sensitivities to foods. So some foods, when I eat them, they make me feel like, bloated or nauseous or whatever it is. I I'm not understanding all of language, so that I miss important things that are happening around me. I don't like giving eye contact, it feels too intrusive. I don't know really how to fit in or how to interact. The pace of everything around me is either too fast or too slow. I mean, I could go on and on. Every single one of these symptoms would cause anxiety.
Yeah.
It's kind of like, how would you have autism and not have anxiety? So,
Exactly.
so it's a very, very common thing. And as our kids learn more and more skills and they learn to adapt, the anxiety goes away because they become more successful and they become more able to interact. This is again going back to the very beginning of this show when we talked about, wanting our kids to be normal. And it's not about being normal, it's about being able to not experience anxiety in the environment that they're in. It's about being learning skills enough so that you can cope. I used to say cope, now I say thrive in society. And so that's kind of where you're at. But in before your child can gain those skills, I really recommend getting them some support through both a psychiatrist and a psychologist.
There we go. And he wrote back in and said, thank you so much that they have an appointment next week and that they've been
Great.
doing daddy fun days away from school, which is great.
Oh,
I also want to say a programming note that on Thursday's show, Let's Talk Autism with Shannon and Nancy, we have the authors of the book, the Autism Anxiety book.
very
So
good.
they're going to be with us on Thursday. You guys can tune in to watch that too. I do want to get to this question because Emily has written in and said that she says, I have a lot of meltdowns. I scream and cry and I
Oh,
need some advice. My neighbors hear me screaming and they think that I abuse my dog. I do not. I love animals. I just can't stop screaming. And I don't know why I can't stop screaming. Any advice for her?
yeah, Emily, I don't know enough about your background, or if you have a diagnosis, or if there are specific things you can tell me about what is actually causing you to be so frustrated. Sometimes, hey, sometimes we all need to have a meltdown and scream. But I mean, if it's at the point where you feel, I'm more, I could say in the old days, like in the 70s, people would actually take a pillow and scream into it as a therapeutic technique. But my concern is more figuring out what is causing that for you, and then that level of frustration, and then trying to help you uh, gain skills that help you overcome that.
She has written back and said that she does have an Asperger syndrome diagnosis and she has an anxiety disorder.
Yeah.
Sending you a
Well,
hug. Em.
yes, absolutely. Sending you a hug, Emily. And again, the same advice, especially, I say this to all of my adult Asperger's patients, especially when you have Asperger's, it is extremely important to get therapy, psychological therapy, because you are more aware, and it is more difficult for you to tolerate and understand. I think a lot of times, and Emily, this might make sense to you, the hardest thing is being able to take someone else's perspective. And when you're unable to take other people's perspectives, they just frustrate and annoy you. It's that simple. And if you can get better at understanding other people's perspectives, that will help you tolerate them better. But until then, so because that's a gradual process of, like, learning perspective taking, theory of mind, learning those skills that have to do with how other people feel, how other people think. Why do they believe the things they do? Why do they say the things they do? What led them to become the people they are? Learning all of that takes time. And while you are learning that, talking to a therapist who will help you with that, by the way, a psychologist will usually help you see other people's perspective better, and maybe even talking to a psychiatrist and getting some of those anxiety medications that I talked about will help you feel calmer in your own skin, will help you feel less judged. and less just, you'll feel like, okay, I'm okay. Like my environment is okay. I have things around me and this is where Shannon and I always talk about the fairness of the universe. Like you need to make sure your environment is fair, that you're getting enough goodies, reinforcers, because otherwise, hey, listen, anyone who doesn't have enough like reward from their environment is just going to want to scream.
Yeah. Amen to that. We're here at the end of the show, and I want to get to a couple of things. Janet wanted me to say my email address again, please. So it's Shannon at autism-live.com. So Shannon at autism, and then hyphen, which is the dash, live, live.com. And you can write to me with questions for Dr. Doreen as well. I do want to say, Andre, you made me cry a little bit here. Andre says, I fell in love with ABA thanks to you, Shannon, and to you, Dr. Doreen. I'm taking a post-graduation in ABA in Brazil at the moment where I live.
Wonderful.
I'm pursuing a professional path to become a BCBA someday. You have no idea of the role both of you have played in my son's improvement. Thanks from the bottom of my heart. You've made my entire day.
Me too. Give me goosebumps. Thank you, Andre.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autismnetwork.com. We hope to see you there.